And as coronavirus vaccinations are underway statewide, it's hard not to notice the racial disparity data on who's getting the vaccine. 22 News reporter Katrina Kincaid explains the data and what's being done to close the gap.
State and CDC data show that black people contract COVID-19 and die from the virus at higher rates than whites. Now, their data shows they're receiving less doses of the vaccine.
Population of people who are really at greatest risk are also at greatest risk of not being protected with the vaccine.
State data shows that white residents have received nearly 36% of vaccine doses. Almost 20% have gone to residents identifying as multiracial, and then the numbers drop. 3.3% for Hispanics, 2.8% for Asians, and lastly 2.6% for blacks.
This is a tremendous problem.
Baystate Health says access to the vaccine, digital scheduling, and transportation are big barriers.
A big deal, I think, in this is the vaccine scarcity right now. When there's a situation of scarcity, it stacks the deck against people who are disadvantaged.
But the disparities don't just come from access. There's a lot of medical distrust in the black community ever since the Tuskegee syphilis study, where researchers did not inform black men fully about the disease and opted not to give them the cure.
It makes sense that people may have that in the forefront of their mind and be mistrustful because of that.
Baystate's Mitigation Committee does community outreach to combat vaccine mistrust in communities of color.
So we're really sort of working to try to gain trust, get information out there, make sure that the information, the other piece of this is that it has to be consistent and it has to be clear.
It's important to note that 35% of people chose not to reveal their race or identified as other. Working for you, Katrina Kincaid, 22 News.